want to make a few points, and I'd like to submit something for the record. Dr. Davis, I think your own personal story, in a way, parallels what I think is happening in our overall medical system, where you've gone from the childhood illness you talked about to becoming a cardiologist and then into functional medicine focused on longevity. And we as a medical system have focused for so long on, as you put it very, very well, I'm just repeating what you said, on treating disease after it occurs. And the results aren't very good. And in fact, I think about 90% of our total medical costs are due to these major chronic diseases, cancer, talked about that, diabetes, talked about that, heart disease, and Alzheimer's. Costs in the U.S. of our Medicare system, or medical system, to be massive compared to even other countries, and our population is sicker. So it's not working, and we're on the cusp, I think, of real change to the medical system that you're all talking about. And that is, we now have a medical system that is starting to learn about the microbiome, as you had talked about, and its impact, about our immune system, about inflammation and what that does to disease, about environmental toxins and the impact. And we're, I think, now have available to us all of these new treatments that we're in the infant stage of, but it's going to dramatically change both lifespan, both the health of individuals as they get older. And in fact, there's what I'd like to introduce to the record, Mr. Chairman, is a study by Deloitte that was done just recently, and it found that, well, I'll read it. It says, Deloitte research shows that disease prevention investments could boost health and longevity, help secure Medicare's future, and cut U.S. medical and drug spending by $2.2 trillion a year. To Mr. Bean's point, I think about the debt. I mean, this is a major driver of our annual deficit. And so not only can people be healthier, but we can save trillions of dollars at the same time. Mr. Chairman, I'd like to submit that to the record if I may.
Yeah, without objection, so ordered.
Thank you. And Dr. Davis, how much time do I have there?
You got a minute 40.
Oh, I got a minute 40. All right. I think the way you framed it is really important, and that is that today these treatments we have are accessible if you've got a lot of money, and you're able to put the money into it. Like, people can go to your treatment and others and get IV and can get lots of longevity treatments, we can do things with plasma and all of these. And I think the real challenge, and it is a moral question, I think, is how do we take that and extend it to the general population who may not have access to that treatment now, and that we're learning that really can work and could begin to address some of these chronic diseases that we have. And all of you are doing great work in this area, but I don't know how to design a system. What was really, and this is what we got to figure out. This is a big challenge. But what was really fascinating, I think, Dr. Rekas and Mr. Darius, you talked about individuals being afraid to take the preventative or the diagnoses, essentially, because either, I don't know if it was because they're afraid of learning about an illness they might have, or if it's more, as you both sort of mentioned, it's potentially about the concern about the cost. So isn't that kind of amazing that, like, our system is designed not to accommodate what we know works. Like, literally, we don't pay for a screening that could prevent long-term costs for that individual or for the system. So I don't know, like maybe if I don't know, I know I don't have much time, but I'd love to maybe get a little bit of your thoughts on maybe a reaction to that. How do we change the system to incentivize that kind of prevention rather than the chronic disease, the system that we have now? Maybe Mr. Ruckus, if you just want to address that.
Yeah, I think it's a tremendous question, and we could look at other industry. You know, we look at like automotive insurance, for example. If you go a certain period of time without getting in a wreck, your premiums go down. Why can't we have a system where if our patients are doing the right thing, seeing their primary cares early, getting their screening tests, getting their CT scans if they're a smoker, getting their blood work that can help guide the direction, that we can't incentivize them by either decreasing their copays or by decreasing their premiums? We have to help the patients do the right thing. And I think by controlling the money and looking what other industry has been able to do successfully, it could help.
Well, I know I am out of time, but I think that is the question. Why can we not have this in place? And we should be working with all of you and many other experts around the country to figure out how we can do this and to really address the medical system and change the medical system to make that care accessible to everyone. So thank you so much.